In second grade, my daughter started having trouble with spelling and reading. She had A's and B's, so she was a good student. But when she finished second grade, her second grade teacher, who was also a friend of mine, offered to tutor her for the summer in like language arts and the phonetics, etc. We didn't notice anything particularly different about her, but as the summer went on, she got better and better. And then when the other thing that this teacher had suggested is maybe we have her tested by a neuropsychologist for anxiety or depression or ADD. So when we got tested, that was that summer as well. She was sort of inconclusive. He determined that she was probably just delayed and that she would catch up and do really, really well. She fact and tested very well in math. So we started third grade and everything went really well for third grade. AB student. She struggled with spelling, but if she studied hard, she got good grades. Reading still was a struggle, and she didn't particularly like reading, I think, because she struggled at it. Then we got to fourth grade. Fourth grade went pretty well. We started out AB student. By Christmas, she was a lot more C's than A's or B's. And then just before spring break, there were, no more A's and B's. It was all C's and D's and F's. She was trying her best, but she wasn't getting anywhere, and I knew that there was something wrong. We couldn't figure it out. Discouraged, distraught, worried that she might not pass fourth grade, I called her pediatrician and made an appointment with just he and I. And they take accelerated reader, which is the reading test. You read a book and you take a test, and there's a goal every semester for so many points. Well, she had read like probably 20 books and had a 0 in every test. And then there was a book they even read in class that they discussed in class, and she failed that test. And then later the teacher shared with me that she had taken her test at a computer in the first grade room, which then kind of was like strange. And as I look back, it was probably because she failed because she was more interested in what was going on in the first grade room. So when we saw the pediatrician, he said, well, I think we should do a trial of Ritalin. What do you think about that? And I was not, thrilled about it, but I thought, well, we could try it. So I filled the prescription and talked to my husband, and we sat her down and talked to her about it. And initially, she was a little afraid to do that. She was worried that, she would be different, etc. And so I just explained that, it's no different than having asthma or having high blood pressure. It's just a medicine that you take to help you think better. So the first day she took it was on a Wednesday, and she was she would call me every day after work or after she got out of school, but I was still in work, and she would, Mommy, when are you going to be home? Kind of in this little whiny voice. And on that Wednesday that she took the medicine, she didn't call me. So I called her, and she sounded very confident on the phone. And I said, well, how was your day today? Oh, it was good. And I said, did the medicine help you? Well, I think so. I could hear it, but I didn't have to listen to it. And that was kind of a strange thing to say. So I said, well, what do you mean by that? And she said, well, like I could hear the clock ticking and people walking by and the pencils on the desk and the cars driving by, but I didn't have to pay attention to it. So that was kind of an aha moment. So the next day was Thursday, and the teacher was working with her math. So on Thursday, she got to have her Friday test Thursday night at home, and we would work on it, and she would get extra credit if she got them all right. And that 5-question test was about an hour's worth of homework for us. And I got home, and I told her, go ahead and start working on it. And I changed my clothes, washed my hands, got ready to start having dinner. And she said, Mommy, I'm done. I thought, oh no, this can't be good. And she handed me the paper, and I looked it over, and she had them all right. And she said, I could remember them from yesterday. And so I knew that this was our answer. This was what was going to work for us. And today, that was fourth grade. So today she'll be a freshman in high school. She's not, not delayed really in any way. She's taking an academic English class and an honors geometry class. So she's really excelled and made up for that.
As you heard from Jan's story, it is extremely important to be able to see what's going on with a child when they're struggling and to determine what is the cause of this struggle. If we have interventions that are early, it can help to alleviate some of the negative experiences that a child and a family can experience when they're still struggling to try to find out what it is. When it comes to ADD, attention deficit disorder, or attention deficit hyperactivity disorder, sometimes it can be very easy to diagnose, especially if you have a child that is hyperactive. If you have a child that's not hyperactive, it can be much more difficult to determine the diagnosis. Typically, the diagnosis for girls with ADD is between 4th and 6th grade. So it was just what we saw with Jan's daughter right at that time, where it's like they're trying so hard to be able to be successful in what they're doing, but there comes a time when they cannot make the other modifications that they have learned from the past to continue on with what they are needing to do academically. It's important in a situation like this that we also try to decide what is going on, because there can be many things like, is there a delay in their cognitive skills or their IQ or their thinking? Is it a learning disability that their cognitive skills are absolutely fine, but that they learn a different way? Or is it anxiety? They are just so worried about something that they cannot do well in focusing and concentrating and being successful academically. Or is it something like attention deficit disorder or attention deficit hyperactivity disorder? So first is going to be recognition that there is something going on. And as we heard with Jan's daughter, it's like she was doing very, very well and was making good grades up until that point in time. So we know that there wasn't a cognitive problem going on there. Then the next thing to look at, is it academic? So that, she was making good grades, but then they kind of fell. So less likely that it was probably that, because she was doing well from the get-go. And typically learning disabilities are diagnosed either at 1st, 3rd, or 6th grades, just because of what the material is being presented to the children at that time. And so, as Jan had mentioned, there was a concern about anxiety. So that is a very valid concern as well, but was not the whole picture for her. And many times as a physician, we are faced with, puzzles like this, and we've got to kind of figure it out. Many times we can see that there's something in one area and not the other. It's like, okay, let's see what's going on there. But most of the time with ADD, you're going to see it through all environments. And so usually that gives us some information as well. Now, there can be times where it's like it still is a little bit confusing what's going on here. And those times it's like, I think there might be some ADHD or some ADD going on. And our best way to be able to tell this is, do we try a trial of medication? And so many times that might be something that is also approached with the family. Many families can be very hesitant to do medications because it's like, those can be drugs that they can become addicted to, and they have side effects and the like. And, if you give that medicine to anybody, won't they be able to pay attention no matter what? Will that be able to tell us? But what we found is that children with ADHD and ADD, there is an issue with the neurotransmitters in their brains. And what these medications do is to help with having those neurotransmitters available so they can focus and concentrate. And so I try to be able to tell families like, okay, I understand your concern. Let's go over some of the side effects you may see, but then let's also see what the benefits are. And usually these medications work very quickly, as we saw with Jan's daughter as well, within just one dose of medication. And as we saw with Jan's daughter as well, is that she was not able to even kind of tell us about some of these symptoms that she was experiencing with ADD, because that was just kind of normal for her. And so many times we can find out more even after we treat, because she said, it's like, oh, now I don't have to pay attention to them anymore. And so we can, have some really good experiences with the use of medication. Now, there are other things that can be done as well, and there are some families who prefer no medications without trying other things, which is understandable. But, within the school setting, there is something called an Educational Plan 504, which will help with modifications for children with ADHD or ADD. Many times, again, look into any secondary characteristics that may be coming along, like anxiety, because sometimes that might need to be treated and along with the ADHD as well. And then, of course, the medication, which we can tell pretty quickly that does this work or does it not. Now, granted, when we're talking about behavioral medications, every child is not the same. And so, unlike an ear infection, where I know the dose of the antibiotic that you use, you don't necessarily know what medication may work the best and what dose. And so that's where it's like finding out what's kind of going on, what the child needs, how long do you need it to act, is how we come up with the best medication to be able to treat. And I've had numerous times where I've been with families that have been hesitant to try medication. I'm like, I really think your child would benefit from this. They come back very, emotional about, I wished I would have done this sooner because it's made the world of difference. And again, you can see how it affects that child's self-esteem. And then in turn, how it helps that family be in a more harmonious situation where you're not struggling with sitting down and doing the homework that we knew she could do. She just needed to focus. And so it's really very satisfying when we've got that diagnosis, we've got that treatment, and you can just really see these kids excel at what they can do and just really show off their talents.
Well, by now everyone has seen and heard Jan's story, which to me was very impactful and really highlighted, I think, really one of the most important issues of developmental issues, and that is they're a medical problem. And it was right on the heels of when my husband had been diagnosed with a medical condition. He had a heart arrhythmia, and his heart was going really fast and abnormal. And thankfully he got into the doctor right away, was put on the right medicine, and the next day was so surprised that his heart rhythm had converted to a normal rhythm and was the right pace and was not having any symptoms anymore. And then a few days later I heard Jan's story, and I thought the parallels between that, they're both medical issues. One's just above the neck. And we need to really begin to expect and look for that type of approach, where we're looking for a medical issue, we're trying to make sure that we diagnose things properly, quickly, and get people on the right medication, whether it's for a heart arrhythmia or a developmental disability or depression, anxiety, any of those types of things. And her story just highlighted both her daughter and my husband had immediate relief when the right diagnosis was made and the right medication was started, and that was just so powerful to me. And again, I just really hope people really begin to look at these types of issues, not with, angst or like it's some sort of stigma, they feel stigmatized. I really hope they begin to just look at them as just another medical condition that we are very equipped and prepared to be able to diagnose and treat.